As we start to understand what are the changes in the brain that occur in people that are addicted, it has given us enormous insight about what it entails to have free will and to be able to exert control over your decisions. Because addiction, at the fundamental level, is a loss of the capacity to decide what you want to do and be able to carry it through. So by creating this sensation of pleasure, which is transmitted by release of dopamine, not only you have that experience, but unbeknownst to you, you get conditioned. And what is conditioning? A deep memory in the emotional parts of the brain that will recognize that stimuli the next time that you see it and will generate the drive and the motivation to pursue it. When we use brain imaging, this is a radioactive substance that concentrates in the central parts of the brain, which are in red there. That's where you have the areas of the brain involved with reward and motivation. To the left, you see an individual when they are not taking a drug, and to the right, you see the individual when they are taking a drug, like cocaine, which increases dopamine. The dopamine floods the brain and removes the radioactivity. So this is understood right now is the reason why the drugs can produce addiction. And for many years, in fact, it has been believed until very recently that people who are addicted to drugs, because they were just more sensitive to the rewarding effects of them, more pleasurable, there was more dopamine released. However, when you apply these tools to actually look inside the brain and see if that is the case, which is the next slide, it shows absolutely the opposite. In the upper part, you see normal control images. In the left, with no drugs, in the right, with drugs. And you see that the red is going down because dopamine has gone up. It has pushed the radioactivity away. The lower panel shows people that are addicted to cocaine, and you can barely see any difference when they are with or without drug. And that is because in an addicted person, contrary to the belief, the drug no longer can produce large changes in dopamine. So then, how do you then make sense of something like that? And that is the essence of the fundamental understanding of addiction. You have transferred the value of the drug into the stimuli that surrounds the drug. This is what we call the conditioning, and so in these images you see no effect of them. No effect of the drug in person that is addicted. But if you subject them to cues, seeing a person that they have taken the drug with, seeing the paraphernalia of the drug, take a $10 bill with which they may have snorted, then see what happens. And that is the next images. When you expose individuals that are addicted to drugs to cues, this is no drugs. You can see a control video that is neutral versus when they are observing a video that is full of scenes of conditioned stimuli. You can see that the radioactivity has gone down because dopamine has gone up. So that is why in many ways it is so extraordinarily challenging to treat people that are addicted, because the stimuli has been transferred to conditioned environmental stimuli, so that when they go to treatment, they don't want to take any more drugs. They go back to the environment, but their brain is wired like this to release dopamine the moment they see a stimuli. a person with whom they have taken the drug, and that elicits the enormous desire to take that drug, and that's why they relapse. And at the same time, in parallel to this shifting the hypersensitivity to the conditioned stimuli, we now know that repeated administration of drugs damages the areas of the brain that Tom was speaking about. The frontal cortex that allows you to exert self-control, decision-making, judgment. And so, on the one hand, you have this enhanced drive to take the drug when they see a conditioned stimuli, but on the other, this area of the brain, and that actually shows up there, you can see some images that monitor how much glucose the brain is consuming, and when you have pathology, you see a decrease of glucose consumption. Very, very sensitive indicator of brain pathology. You see a normal person in the frontal cortex in this area here on the upper left, and you see the person that is addicted. You see how eroded the activity of that area of the brain is. So this area is metaphorically the brakes of your brain. So it is like one thing, and that is what you hear from drug-addicted people. They tell you, I don't understand why I take the drug. It is not pleasurable. I just cannot control it. It's like driving. You want to stop. Without brakes, you cannot stop. And this exactly is the essence of what we call, of course, free will. Because you want to be able to say, I don't want to do this. I want to be able not to do it, and most of us, most of the time, succeed.
What is this teaching us about how to address addiction or treat addiction?
Well, first of all, it is telling us these changes are long-lasting, unfortunately, and they persist months and sometimes years after a person stops taking the drug. So it is a chronic disease, which means that to start with a treatment of addiction will require some sustainability. The notion that you are going to go for rehabilitation for 1 month and you are going to be cured, unfortunately, is not correct. It is magical thinking. Addiction is like hypertension or diabetes. You need treatment for a long period of time. The identification that addiction is not just in one region of the brain, but it involves multiple circuits or networks, also identifies that you require a multi-pronged approach for its treatment. So can you strengthen self-control? Can I do something as a therapist with behavioral interventions, with exercises of the brain, or with medication to strengthen that frontal function? Can I do something through, again, behavioral intervention or medication to weaken that conditioning so that when I see that stimuli, I don't desire them? Can I do something as an intervention to make that reward center that is no longer very active respond to natural stimuli so that the person gets motivated by things that are not just the drugs? So it's a multiple approach, multi-pronged approach, and recognition that it is a chronic disease.